This is the Chapter 5 of the Maternal Newborn ATI, Nutrition During Pregnancy. Adequate nutritional intake during pregnancy is essential to promoting fetal and maternal health. Recommended weight gain during pregnancy based on a single pregnancy is 25 to 35 pounds. The general rule is that the client should gain 2 to 4 pounds during the first trimester, and after that, approximately 1 pound per week for the last 2 trimesters. This varies for underweight, normal, and overweight clients. Excessive weight gain can lead to abnormal fetal growth and labor complications. Inability to gain weight could result in low birth weight of the newborn. It is important for the nurse to evaluate the pregnant client's nutritional choices, possible risk factors, and diet history. The nurse also should review specific nutritional guidelines for at-risk clients. Assistance is given to clients to develop a postpartum nutritional plan. Assessment. Obtain a subjective and objective dietary information. Journal of the client's food habits, eating pattern, and cravings. Nutritional related questionnaires. The client's weight on first prenatal visit and follow-up visits. Laboratory findings. Determine the client's caloric intake. Having the client record everything eaten during a 24-hour period. The nurse, dietitian, or client can identify the caloric value of each item. This record can provide better objective data about the client's nutritional status. Client education. Adhere to and maintain the following during pregnancy. Increase calories. An increase of 340 calories a day is recommended during the second trimester. An increase of 452 calories a day is recommended during the third trimester. If the client is breastfeeding during the postpartum period, additional caloric intake is advised. Increased protein intake is essential to basic growth. Folic acid is crucial for neurological development and the prevention of fetal neural tube defects. Folate found naturally in foods is converted to folic acid. Foods high in folate include leafy vegetables, dried peas of beans, seeds, and orange juice. Iron supplements are often added to the prenatal plan to facilitate an increase in the maternal RBC mass. Iron is the best absorbed between the meals and when given with a source of vitamin C. Milk and caffeine interfere with iron. Food sources of iron include beef liver, red meats, fish, poultry, dried beans, and fortified cereals. Calcium, which is important for the developing fetus, is involved in bone and teeth formation. Sources of calcium include milk, calcium-fortified soy milk, fortified orange juice, legumes, and dark green leafy vegetables. 8 to 10 glasses of fluid are recommended daily. Preferred fluids are water, fruit juice, and milk. Limit caffeine. The American College of Obstetricians and March of Dimes recommend a daily intake of no more than 300 milligrams of caffeine. Avoid alcohol. It is recommended that clients abstain from alcohol consumption during pregnancy. Risk factors. Age, culture, education, and socioeconomic issues could affect adequate nutrition during pregnancy. Also, certain conditions specific to each client might inhibit adequate caloric intake. Dietary complications during pregnancy. Nausea and constipation are common during pregnancy. For nausea, eat small amounts frequently to avoid large meals that distend the stomach and avoid alcohol, caffeine, and fried fatty foods. Do not take medication to control nausea without first checking with your provider. Ginger and herbal teas might also be helpful. For constipation, increase fluid consumption, perform physical activity, and include extra fiber in the diet. Maternal phenylketonuria is a maternal genetic disease in which high levels of phenylalanine pose a danger to the fetus. It is important for the client to resume the PKU diet for at least 3 months prior to pregnancy and continue the diet throughout pregnancy. The diet includes foods that are low in phenylalanine. Foods high in protein must be avoided due to high phenylalanine levels. Aspartame, which contains phenylalanine, should be avoided to pregnant clients who have PKU. The client's blood phenylalanine levels are monitored during pregnancy. Diabetes. Both pre-existing diabetes and gestational diabetes are complications that require nutritional interventions. Monitor the amount of carbs in the diet and keep glucose levels within target range. Limit the amount of sweets and desserts, which typically have large amounts of carbs. Creating a postpartum nutritional plan. A lactating client's nutritional plan includes the following instructions. increase protein and caloric intake while adhering to a recommended well-balanced diet. A nutritional plan for a client who is not breastfeeding should include resumption of previously recommended well-balanced diet. Refer clients who need financial assistance to WIC, which are federally funded state programs for clients and children.